pandemic, where there are currently over 110,000 cases of the disease. The president is expected out any moment now. He will be speaking today in the Rose Garden of the White House. We may expect a feisty briefing today. He tends to get a little more worked up when he is outdoors. It's a little bit chilly for an outdoor evening briefing. The temperature in Washington, D.C. is currently under 60 degrees. And if you have questions while we're waiting for the President of the United States to come out, please leave them in the comments, and we will try to use this time to answer them. Now, if you missed yesterday's briefing, you missed quite a show. Even in Trump-adjusted terms, it was really a bizarre event. The President spent the first 45 minutes of the briefing essentially making the case that the media has failed to give him adequate credit for his response. He played, in essence, a 4-minute campaign video, which was later found to be a clip from the Sean Hannity show, which laid out a somewhat revisionist timeline of the president's actual response to this pandemic. He set up a sort of false equivalency, suggesting that anyone who is criticizing the speed of his response is essentially saying that he should have completely shut down everything in the country before there were any cases of the coronavirus here. Of course, those aren't the two options. One could do what other countries did. The president was saying, why would you shut the country down completely in January before there were any cases? Well, you don't need to do that, but what you could do is what Germany did, and in January began working on tests before there are cases. That's something one could do. That's not what he did. He also, one of the most news-making moments is that he claimed that, I want to read the quote to you exactly. He was talking about how he intends to reopen the country within the next few weeks. And he said, he was questioned, well, what if governors in individual states don't feel that it's time to remove these stay-at-home orders? And he said, when somebody is the President of the United States, the authority is total. And that's the way it's got to be. Constitutional scholars and sixth grade civics students, anyone who's watched Schoolhouse Rock or fans of the musical Hamilton, may be aware that the president's authority is not total. There actually are extreme checks and balances. The president is part of 3 co-equal branches of the federal government, and the 10th Amendment of the Constitution specifically says that those powers not enumerated in Articles 1, 2, and 3 of the Constitution are reserved for the states. Well, President Trump is tweeting. He's going to be a little delayed coming out tonight, so we have time to answer your questions. So go ahead and type your questions, and the team and I will do our best to answer them while we await the President of the United States. Again, my name is Alan Piper. I am the senior politics producer for NowThis, and we are going to be giving you shortly the President's live daily fact check. We have been doing this for several weeks now because we feel that it's important to cover the President's briefings, but it's also important to cover the facts that are frequently missing from these briefings. So while you are typing your questions in, I want to go over the timeline a little bit, because the President really laid out a false timeline yesterday in the briefing, suggesting that his response to the coronavirus pandemic was very fast and very effective as compared to other countries. And the fact of the matter is that it's not. Yesterday we talked a little bit about how long before there even was a coronavirus epidemic, President Trump took steps that made us less ready for such an event by firing President Obama's Global Security Health Unit from the National Security Council, by cutting prevention funding for the CDC, which caused it to downsize in 39 countries, including China. But let's just go into the timeline of this specific disease and his specific response, since he spent a lot of time laying out that timeline yesterday. And while I'm going through the timeline, I invite you to please type your questions in the comments, because I will do my best to answer them as they come. So, in November, ABC News now reports that the first intelligence warnings were sounded in November of 2019, that there was a dangerous virus in China with the potential of spreading. The president did not act on those warnings. Reuters reports that the National Security Council was briefed on December 31st. The president did not take action then. January 8th, the CDC issued its first warning. The president did not take action then. January 9th, President Trump held a rally. January 14th, he held another rally. January 18th, the Washington Post has revealed that Secretary Azar of Health and Human Services tried to have an urgent call with the president about this potential crisis, and President Trump cut him off to berate him about his handling of an attempt to ban flavored vaping products. He then hung up and went golfing. January 19th, he went golfing again. January 20th, this is an important date. The first cases of the coronavirus were reported in the United States and in South Korea. And I want to highlight the timing of these two countries, because we ask ourselves, what would have happened if the president had reacted differently? And we don't know exactly. Dr. Tony Fauci acknowledged on CNN that if the president had acted sooner, lives would be saved. He, with quite the look of a person recording a hostage video, he sort of walked those statements back yesterday at the beginning of the briefing. President Obama's national security advisor said that she believes that tens of thousands of deaths, unnecessary deaths, were the result of the delay of President Trump's action. But if you want the clearest model of how things could have been different, you just need to look at how two countries reacted on the same day. January 20th, the first confirmed case of the coronavirus in the U.S., the first confirmed case in South Korea. South Korea implemented widespread testing within 2 weeks and immediately began issuing social distancing guidelines. To date, there have been, let me double check on the number. To date, there have been only 222 deaths in South Korea, as compared to 25,000 deaths in the U.S. Now, the U.S. has a bigger population, so we should expect a higher number. We should expect the U.S. death toll, if both countries responded equally well, we should expect the U.S. death toll to be about 6 times that of South Korea. It is instead about 113 times that of South Korea. And whereas the increase of deaths is slowing in South Korea, it is still continuing to grow in the U.S. Now, so that is a pretty striking beginning of the timeline. But what happened after that? January 22nd, President Trump was asked whether he was worried about the coronavirus, and he said, and I quote, "No, not at all." And he said, "We have it totally under control. It's one person coming in from China. It's going to be just fine." That was January 22nd. We are not quite 3 months later, and we have gone from one person to nearly to over 589,000 people in the U.S. January 23rd. This was a big warning day. China shut down the entire city of Wuhan. Senate Minority Leader Chuck Schumer recognized that as a big warning. He called for an immediate public health emergency. President Trump did not enact one. January 27th, Joe Biden wrote an op-ed warning that President Trump was already failing in his response to the coronavirus and needed to take more immediate action. January 28th, Elizabeth Warren, who was still in the race at the time, released her coronavirus plan. This is before the President of the United States had a plan. That night, President Trump held a rally. January 29th, only then did President Trump, 21 days after the CDC issued its first warning, President Trump finally formed the first coronavirus task force. We also now know that on that date, his trade advisor, Peter Navarro, issued a warning. He wrote that the lack of immune protection or an existing cure or vaccine would leave Americans defenseless in the case of a full-blown coronavirus outbreak on U.S. soil. And in a memo warning members of the administration, he said this lack of protection elevates the risk of the coronavirus evolving into a full-blown pandemic, imperiling the lives of millions of Americans. January 30th, China expanded its lockdown to the entire province of Hubei. Also that day, the World Health Organization declared a global health emergency. President Trump that night held a rally. In late January, we now know that the Department of Health and Human Services requested $136 million for fighting the virus, and the White House refused. February 1st, Trump went golfing. On that day, Vietnam halted all flights from China. No excuses. No one from China can enter Vietnam. The next day, only the next day, February 2nd, did a partial travel restriction go into effect on passengers from China coming to the U.S. And it had big exemptions in it. Some 20,000 people have arrived in the U.S. from China since, including U.S. citizens and other authorized travelers, and about around 400,000 people had already entered in January and February. So when President Trump, he likes to talk about how he's saved so many lives by putting travel restrictions on China, this is very much a case of closing the barn door after the horses have left. 420,000 people entered the U.S. from China, and it was far too late, according to multiple public health experts, for these restrictions to have had a big impact. What they could have done at that point was to have slowed the spread, and yet President Trump, in the time, any time that might have been saved by putting those restrictions into effect on February 2nd, squandered that time by not declaring a public emergency until a month and a half later. All right, so I want to go further into the timeline, but we're beginning to have some questions here, and I want to use this time to answer them because President Trump doesn't tend to be so forthright in answering questions that he gets from reporters. So let's at least use this part of the time to get some questions answered. Carol asks, do the announced COVID death rates in New York include deaths at home or just hospital deaths? And this is a crucial question because WNYC in New York has actually done some excellent investigative reporting on this topic. I'm going to look up a couple of their stats that I had written down. So the answer is that New York City has added more than 3,700 additional people who were presumed to have died from the coronavirus but never tested positive. The new figures released by the city's health department drove up the number of people killed in New York City to more than 10,000 and appeared to increase the overall U.S. death count by 17% to more than 26,000. That's higher than the number that we're currently registering from Johns Hopkins at the moment. But WNYC is suspicious that these numbers are still too low, because WNYC recorded in the past month a 400% increase in deaths at home. And that seems like a very startlingly large uptick in deaths at home. And it does beg the question, are many of these undiagnosed cases of the coronavirus? I see more people are starting to arrive, so the president is probably going to be here very soon. Again, if you're just joining us, my name is Alan Piper. I'm the senior politics producer for NowThis, and we are doing our daily live fact check of President Trump's coronavirus task force briefing. I want to give you a little additional information on what President Trump has been up to today. He has been attacking governors. He's been attacking Democrats. When he comes out, depending on how worked up he is, he usually begins his briefings by reading a written statement. And in the written statement, he calls for unity and he praises all Americans for how they have pulled together to face this crisis. Those are his scripted remarks. Once he goes off script, he goes on the attack. And so be on the lookout for that today. I also want to highlight what else he was doing today. Earlier today, he met in person in the cabinet room with 13 health industry CEOs. Please bear in mind that the President of the United States has issued guidance suggesting that people should not gather together in groups of more than 10, and that they should remain a minimum of 6 feet apart. It is not possible for 13 health insurance, but health industry CEOs and their staffs and the President of the United States and his staff to all gather together in the cabinet room and remain more than 6 feet apart. The President has also advised that anyone who is expecting to come into close proximity with other people should wear a mask, but he himself has said that he will not wear a mask. I think it is likely that in his cabinet briefing today, where he was within close proximity of many people, that he was not himself wearing a mask. Now, everyone who entered the room would have their temperature taken, as has been the protocol at the White House, but we now know that at least 25% of people who have the virus and are contagious are not yet presenting symptoms and would not have a temperature. It is remarkable to see the lack of care that the President of the United States is taking for his own health security at a moment of national crisis. All right, now Anna asks, are the reports of people who recovered from the coronavirus in South Korea retesting positive true? And the answer is yes, that is true. Last Friday, the Korea Centers for Disease Control and Prevention said in a press release that a small cluster of cases at a nursing home in South Korea had tested positive again after recovering from the coronavirus and testing negative. Scientists are giving various explanations for this. The patients could have been infected with a different variation of the virus from the original infection. There could have been errors in the testing, or it could be that the patients never actually fully recovered. Antibody testing is being done all over the world to learn more about this. A few weeks ago in the U.S., the FDA approved the first coronavirus antibody test in the U.S. This test could help scientists learn how widespread the infection is, how long people remain immune after recovering, and also help researchers calculate a more precise death rate. Now, Monica asks, what powers does the president have to put pressure on the nation to open? And that is the big question after yesterday's briefing, in which he declared that he had absolute and total power? The answer is that in response to the stay-at-home orders of governors across the country, while Trump says that his authority is total, this is false. There is no legislation that would allow President Trump to override these public health measures, and the 10th Amendment of the Constitution grants states the powers not directly delegated to the federal government. Governor Cuomo responded saying, "We don't have King Trump, we have President Trump." However, the president does have powers to put pressure on these governors. For instance, the president might be able to slow federal funds to these areas if they don't behave in the manner in which he likes. He could also order federal employees who are currently on the ground, including doctors from FEMA, to return to their offices, and he could also reopen national parks and other federal property. It's very striking that the president has repeatedly refused to call on states nationwide to all issue stay-at-home orders. And there are 8 states at present with Republican governors who have declined to issue such orders. And the president has suggested that he lacks the authority to direct them to issue such orders because of the Constitution. It is striking that he thinks that he lacks the authority to order states to take precautionary measures in a crisis, but has full authority to order them to undo precautionary measures. Rachel asks, if you are diagnosed with COVID-19 and recover, can you get it again? And this gets to the question that Anna had. The answer is that we don't know totally. The belief and hope that both Dr. Fauci and Dr. Birx have expressed is that people who have recovered should have immunity for at least some period of time. That we don't yet know how long that immunity will be, but Dr. Fauci has said it is reasonable to believe that you will have immunity for the rest of the season. Those reports coming from South Korea would tend to suggest the reverse. However, information is still limited, and that is all the more reason why it is too early for the president to suggest strong-arming governors into reopening public areas in states that are desperately trying to flatten the curve. Now, Rachel asks, should we wear masks if we are not sick? And the guidance on this has changed recently. The CDC and the World Health Organization have given a recommendation for all Americans to wear some kind of homemade cloth mask. They say do not purchase medical-grade masks. Please save those for healthcare workers on the front lines. There is a desperate shortage of medical supplies. When President Trump comes out today, he is likely to again say that there is not a shortage, that our doctors and nurses and first responders have what they need. They tell us they do not, and so it's important that you do not use up their supplies. But wearing a homemade cloth mask can, while the full protection value has not been evaluated by the FDA, it should reduce your risk of becoming infected and reduce your risk of infecting others. We have a do-it-yourself instructional video produced by Zara Heder, one of our producers, on how to make your own mask. So we're going to put that video in the comments of this video, and that should help you if you need to make your own mask. In fact, Shelby, if you're able to hear me, I would love it if you could add to the comments Zara's mask making video. Nico's video explaining the facts about President Trump's timeline on his response to the coronavirus. Our political director highlighted the various early warnings that President Trump ignored, and so we'd like to put that video in the comments. And Ian, if you're able to hear me, I would love for you to post in the comments the video that you made highlighting the many times in January, February, and early March that President Trump downplayed the threat of this virus. So the President of the United States should be out shortly. I'm going to check his Twitter account to find out what he's been up to. If you're ever wondering where the President of the United States is, at least this president, you can usually find out by monitoring his Twitter feed. He has been tweeting about narco-terrorist traffickers. That seems to be one of his concerns about what is coming into the country. He's been suggesting that governors are behaving like the cast of Mutiny on the Bounty. He has been tweeting in all caps about the risk of voter fraud. Spoiler alert, his own voter fraud task force was unable to find any evidence of widespread voter fraud of any kind in the U.S., and the only well-documented instances of significant voter fraud in recent years have actually been committed by Republicans, including in one House race in North Carolina where the election results were actually overturned due to the cheating of the Republican candidate's campaign. He's been attacking Democrats. He's been tweeting Sean Hannity clips. So that's what the president has been up to today. I want to remark again that his briefing yesterday was really striking. While the families of 25,000 Americans are grieving the loss of loved ones, he devoted 45 minutes of his briefing to grieving that his press coverage has not been as positive as he would like. I don't know if we'll see a repeat of that today, but that's what you missed if you weren't here yesterday. So as the questions come in and as our team works to find answers for them, I want to run through a little bit more of the timeline. So we brought you up through the point where the Chinese travel restrictions finally went into place. Again, I want to highlight that in spite of his travel restrictions, some 420,000 people have entered the U.S. from China during this pandemic. We now know that on February 5th, Secretary Azar requested $4 billion to fight the coronavirus. A reminder that he had earlier asked for a smaller amount of money that was turned down. I'm checking on what that earlier amount was. He had earlier asked for $136 million. That was turned down. But as the crisis became more and more clear, by February 5th, his ask was up to $4 billion. The Washington Post reports that this led to a shouting match inside the White House. On February 6th, the World Health Organization began distributing 250,000 tests around the world. The U.S. refused to accept any of these tests, saying that we would make our own. The CDC produced at that time about a total of 90 tests, which turned out to be faulty. February 10th, President Trump, this is February 10th, mind you, February 10th, after the World Health Organization had already declared a global health emergency, February 10th, President Trump proposed cutting an additional 16% from the CDC's budget. That same day, he said that people expect the coronavirus to go away on its own in April with the heat. There were only 12 cases in the U.S. at that point. It is now April. It has not gone away, and there are over 500 589,000 cases in the U.S. That night, Trump held a rally, and he repeated the claim, by April, in theory, when it gets a little warmer, it miraculously goes away. In the middle of April, we are waiting for that miracle. February 15th, Trump golfed. February 19th, he held a rally. February 20th, he held another rally. February 21st, he held another rally. February 23rd, there was another memo from trade advisor Peter Navarro warning, quote, the increasing probability of a full-blown COVID-19 pandemic could affect as many as 100 million Americans, with a loss of life of as many as 1.2 million souls. The president still did not declare an emergency. The next day, only now, did President Trump ask Congress for additional funding to face this crisis. But he tweeted that day, the coronavirus is very much under control in the USA. Stock market starting to look very good to me. February 25th, he tweeted, the CDC and my administration are doing a great, all caps, job of handling coronavirus. And he said that day, I think it's a problem that's going to go away. They have studied it. They know very much. In fact, we're very close to a vaccine. February 25th, he said we were very close to a vaccine. The best estimates have a vaccine now at least a year away. February 26th, President Trump said, you treat this like the flu. The risk to the American people remains very low. The 15 cases in the U.S. within a couple days is going to be down close to zero. That was February 26th. Again, there are 589,000 cases in the U.S. today, and there have been over 25,000 deaths. February 27th, he said, like a miracle, it's going to disappear. February 28th, he held a rally complaining about press coverage of the coronavirus and how Democrats were talking about it, and he called it, quote, their new hoax. The next day, the U.S. suffered the first confirmed coronavirus death. That day, Washington became the first state to declare a state of emergency. That was February 29th. On March 3rd, President Trump said things are going very well. And he said that he didn't think that it was inevitable that it would spread across the country. Only on March 3rd did the U.S. approve widespread testing. And to this date, there still is not a nationwide plan for widespread testing. A reminder that the U.S. and South Korea had their first cases on the same day, January 20th. South Korea was doing widespread testing within 2 weeks. March 3rd was when the U.S. approved plans for widespread testing. On March 4th, President Trump did a Fox News interview where he suggested that it's fine for people to go to work with the coronavirus. And he said also on March 4th that it was, quote, very much in hand. On March 5th, California and Maryland declared states of emergency. On March 6th, Kentucky and Utah declared states of emergency. President Trump that day took a trip to the CDC. He wore a campaign rally hat, and he said, I think we are doing a really good job in this country at keeping it down, a tremendous job at keeping it down. And he promised anybody right now and yesterday, anybody that needs a test gets a test. They're there, and the tests are beautiful. The tests are all perfect, like the letter was perfect. The transcription was perfect, right? To this date, Americans cannot get tests just because they want them. Americans around the country are in doubt, in fear. Many don't know whether they have the coronavirus or not. Governors do not know how widespread the disease is in their states because they do not have enough tests. March 7th, President Trump finally declared, March 7th, President Trump still did not declare a state of emergency. That was when New York declared a state of emergency. President Trump will likely, in this briefing, criticize New York for not acting swiftly enough. New York declared a state of emergency about a week before he did. The president should be expected out any moment. When he comes out, we will do our live fact-checking of his statements. If you're just joining us, again, I am Alan Piper, the senior politics producer for NowThis. We're going to try to answer your questions while we are waiting for the president, so please type them in the comments, and our team will work on getting you the answers that you need. So, as I was saying, on March 7th, New York declared a state of emergency. What did President Trump do that day? He went golfing. That was March 7th. On March 8th, President Trump golfed again. On March 9th, he compared the coronavirus again to the flu in a tweet and suggested that it would go away on its own. On March 10th, he said, quote, "It's really working out," and suggested that it would go away. There were still under 1,000 cases in the U.S. at that point. On March 11th, the World Health Organization, whom he will likely criticize today, upped their warnings and for the first time used the term pandemic to describe the crisis. That only then did President Trump shut down some travel from Europe, which reportedly his deputy national security advisor had been calling for 2 weeks. March 13th, President Trump finally declared a national emergency. That was just over a month ago. That was a month ago yesterday. He did it in the Rose Garden on a day much like this. He stood in this Rose Garden and declared a national emergency and said that Google was building a website that could help you find out if you had the coronavirus. This reportedly came as news to Google when he said it. There still is no such website. He also said that day, a month ago, that Walmart would be donating their parking lots so that everyone could get drive-through testing in those parking lots. That has not happened. On March 16th, he had a call with governors, and on that call, he told the governors, quote, "Respirators, ventilators, all of the equipment, try getting it yourselves." This led to a catastrophe where governors have been explaining that they are competing with each other for necessary supplies. Governor Cuomo said it's like being on eBay with 50 states. You think you've placed an order for ventilators and masks, and then all of a sudden, someone outbids you. It drove up the prices. The governor of New York said that N95 face masks, that the cost went up to 100 times the normal cost. N95 face masks became 100 times more expensive because he was competing with other states for those supplies. Now, on March 17th, President Trump said, finally, this is a pandemic. And he said, I felt it was a pandemic long before it was called a pandemic. Let's remember that on March 17th, Trump acknowledged it was a pandemic and claimed that he was ahead of everyone in calling it that. The World Health Organization called it that over a week earlier, and he, a week earlier, was comparing it still to the flu. On March 26th, President Trump, in a very sad moment for the United States, achieved an unintended definition of his plan of America First. March 26th was the date that the U.S. overtook all other countries in the world for coronavirus cases. It has since overtaken all other countries in the world for coronavirus deaths. The United States had much more warning than other countries did. We now know that the intelligence community was keen to the threat as early as November 19th. But more significantly, we had already seen what was happening in China, in Europe, in Iran. We'd seen what was happening in January and February, and the United States did not take action during that time and did not begin to take serious action until the middle of March. So that is the true timeline that is quite different from the timeline that President Trump spent much of yesterday's briefing going into. All right, so we have pulled some more of your questions. Again, if you're just joining us, my name is Alan Piper. I am the senior politics producer of NowThis. We are awaiting the President of the United States. He is roughly an hour late for his daily coronavirus task force briefing. I'm checking his Twitter feed to see what he's been up to in this time, and it appears to be mostly tweeting his grievances. Kathy asks, also if you're just joining us, folks are typing their questions in the comments, and we're doing our best to answer them while we are awaiting the belated arrival of the President of the United States. Kathy asks, do you think someone created the virus? And the answer is no. This is a conspiracy theory that has been spread by irresponsible outlets, including OAN, one of President Trump's new favorite outlets. Scientists, researchers, doctors, and immunologists have said that the virus is the product of evolution, which is also factually true, not a synthetic creation or lab. It is not a manipulation, as some conspiracy theories have suggested. As outlined in an article for the journal Nature Medicine, a group of researchers found the novel SARS-CoV-2 coronavirus is the product of natural evolution. One of the researchers, Christian Andersen, told Science Daily that, quote, the mutations in the RBD portion of the spike protein and its distinct backbone rules out laboratory manipulation as a potential origin for this virus. So please be careful of conspiracy theories you see being circulated around. This is not, unlike the Captain Trips disease in Stephen King's The Stand, this is an all-natural virus. Also important reminder that things that are all-natural are not necessarily healthy. Cynthia asks, are we going to have to pay this stimulus check money back? And the good news is no. This is not a loan. These checks are yours. They are also not taxed. These checks are intended to relieve the financial strain that many are feeling because of the coronavirus pandemic. The Treasury Department says that the first stimulus payments were sent via direct deposit on Friday. So check your bank account. You might already have some money waiting for you. 80 million people should expect payments in their bank accounts this week. Now, how do you get the direct deposit? If you usually file your taxes online, and if you usually receive money back from the government on your taxes, remember tomorrow would normally be tax day. The deadline has been extended until July 15th, but there's no reason why you can't file them earlier if you want. If you file them earlier and you're getting money back, go ahead and file them and you'll get that money back sooner. So if you are someone who gets money back via direct deposit, that is how you are going to receive this payment. For most working Americans, it's going to be $1,200 each. Once you get above an annual individual income of $75,000, it starts getting tapered off. Once you get above $95,000, you don't get anything. So if your income is above $95,000, I'm very sorry to report that you are not getting this payment. On the bright side, I can congratulate you for having an individual income over $95,000. Good on you. Now, it is important to note that this direct deposit is very convenient for Americans with bank accounts, but there are some 15 million Americans who do not have bank accounts. Their payments will be coming via check. They will be mailed by the IRS, and the IRS has warned that it could take a long time for physical checks to go out, that they might take as long as until September. Now, Ketsy asks, all right, yes, Ketsy was following up on that previous question about when are you going to get your checks. Treasury Secretary Mnuchin says that most Americans who are getting their payment via direct deposit will get it by April 17th. So that is this week. So that is good news for most Americans. Please keep checking your bank account to see if it's waiting there for you. I'm going to check my bank account as soon as I sign off from this broadcast tonight. Lots of people are asking for a video of the timeline that I just ran through. Well, I'll tell you what, there's a video that's not exactly that, but is very similar and goes into more detail, actually, than I went into. And that is of our political director, Nico Pitney, running through the timeline. We're going to put that in the comments, and you should look for it. We also reshared it today, and we will reshare it more in the days to come. And we may make additional videos highlighting that timeline, because it is important to note that timeline. The president played a 4-minute clip that turned out to be from the Sean Hannity show yesterday that suggested a slightly different timeline, and it's important that we acknowledge the actual timeline. All right, so now we have questions about the racial disparities for this disease. Something that we used to like to say is that this disease does not discriminate, and while that is technically true, it is de facto not entirely true. This disease is hitting people of color in this country, and specifically Black Americans, much harder than the rest of the country. We have a series of videos on this topic, and Ian or Shelby, if you're able to put Maddie Green's video that specifically addresses the racial disparities into the comments, that would be helpful to people. Black Americans, per the Census Bureau, make up about 13% of the overall population, but they account for over 33% of the hospitalizations, and the fatality rates are particularly striking. In a city like Chicago, Chicago is 30% Black, but over half the cases of coronavirus are Black Chicagoans, and Black Chicagoans account for nearly 3/4 of the deaths in Chicago. Those statistics are a couple days old. They may have gotten worse. In Louisiana, Black Louisianans make up only 32% of the population, but comprise 70% of the coronavirus deaths. Black Milwaukeeans are a little under half of the state's, half of the city's population, but they make up over 87% of Milwaukee's deaths from coronavirus. We have additional stats that we pulled from the CDC, and I'm going to encourage Zara to post these graphics in our comments. I think that'll be more useful. than my reading them out to you. And so these are very sobering numbers. The reasons for this are multifaceted. They're not entirely understood, but they are, as Dr. Fauci has explained, largely attributable to systemic racial injustice in our medical system, that because for a variety of reasons Black Americans are less likely to have health insurance and are therefore less likely to see a doctor regularly and are therefore more likely to have underlying health conditions that increase the risk of death from the coronavirus. Dr. Fauci has spoken eloquently on the subject and has spoken that even after the coronavirus is no longer an ongoing pandemic threat, we will still need to face the ongoing racial disparities in our health system, and that these crises highlight inherent injustices in our society, and that the response to this crisis and the response to the days and years following it must include responding to the injustices. He was one of the leading figures in coming to terms with America's HIV and AIDS crisis, and how the HIV and AIDS crisis revealed systemic injustices facing gay Americans and Americans of color. And we clipped a video of Dr. Fauci's remarks, and I invite people to watch them. And if Maddie or Shelby, you're able to post that video in the comments, I think that would be of use to our viewers. So Ang asks, are we going to have a vaccine, and how will we prove that we have it? And the answer is that President Trump has optimistically told a gathering of pharmaceutical executives that a vaccine will be ready in 3 to 4 months. Dr. Anthony Fauci has said that a vaccine is likely to be available in 12 to 18 months. 70 potential coronavirus vaccines are being developed around the world, according to the World Health Organization. However, the World Health Organization says that there are currently no specific medicines or treatments to prevent or treat the coronavirus. Junaid asks, is the president still building his wall? The answer is yes. As of January 2020, the Customs and Border Patrol has replaced about 99 miles of existing fencing with new fencing, but only 1 new mile of border wall has actually been built in locations where there was not previously an existing wall. Does it seem like a good idea to be devoting resources to building a wall right now? It might not be a great idea. I've got to tell you that I have family in Yuma, Arizona, on the border of Mexico. Arizona, like most of this country, is under stay-at-home orders, but there are construction workers showing up to continue building the wall. And then they are going back to their communities, to wherever they live and sleep and eat, and they are in close proximity building this wall, and then not staying at home, and then going back out into the community, potentially bringing a threat to others. There certainly is no risk to the U.S. from Mexico, from the coronavirus. The U.S. has over 100 times the cases of coronavirus that Mexico has. If anyone is going to benefit in coronavirus protection from a wall, it would be Mexico. Perhaps we have finally found the angle to inspire Mexico to pay for the wall, as President Trump had promised. Now, we are still awaiting the President of the United States. This briefing was scheduled for 5 p.m. today. It is now 6:15 p.m. We don't know what exactly is going to be discussed today. These briefings frequently do not bring new and enlightening information. They are frequently used for the President to air his grievances, as we saw yesterday. The President has also repeatedly used these briefings to hype up interest in hydroxychloroquine, which is a disturbing thing for the President to do, because hydroxychloroquine has not been proven to be effective in treating the coronavirus. And it is known to have a number of potentially lethal side effects. Okay, I hear audio.
Ladies and gentlemen, the President of the United States and the Vice President of the United States.
All right, the President of the United States is coming out now, and my team and I will work to fact-check him in real time as he speaks.
Thank you very much. Please. Very importantly, I'd like to begin by saying that we've just reached agreement. The Secretary of Treasury, Steve Mnuchin, with the major airlines, all of our great airlines, to participate in a payroll support program. This agreement will fully support airline industry workers, preserve the vital role airlines play in our economy, and protect taxpayers. Our airlines are now in good shape, and they will get over a very tough period of time that was not caused by them. The United States is continuing to make substantial progress in our war against the virus. We grieve at every precious life that has been lost to the invisible enemy, but through the darkness we can see the rays of light. We see that tunnel, and at the end of that tunnel we see light. We're starting to see it more than ever before. We've held our rate, the numbers, everything we've done. We've been very, very strong on it and very powerful on it. You look at what's happening in other countries, Spain, Italy, United Kingdom. We're working with them. We're trying to help them, especially with ventilators. They've been calling a lot. They need ventilators so badly. 15.
The President is suggesting that that we are doing better than other countries. We have the highest rate we have the highest number of cases out of any country in the world, and the highest number of deaths. The U.S. accounts for 30% of the world's cases of coronavirus and 20% of the deaths.
People, it's so different looking out there when I look at you. Their devotion, your devotion, is saving lives. Today I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there.
This is a shocking move for the President to cut off U.S. funding for the World Health Organization in the midst of a global pandemic. He has suggested that the World Health Organization's response has been bad. It's important to note that the World Health Organization declared a global health emergency 6 weeks before President Trump declared an emergency. It produced 250,000 tests a month before the U.S. began any serious testing.
And other nations, they were very much opposed to what we did. Fortunately, I was not convinced and suspended travel from China, saving untold numbers of lives. Thousands and thousands of people would have died.
This is not true. The World Health Organization did not disapprove of the travel restrictions, and in fact suggested that temporary travel restrictions could be a way to slow the spread of the disease. And epidemiologists at Johns Hopkins have said that there is no evidence that the president's move actually reduced the number of deaths. because it came too late and he did not use the time that was gained from it to make preparations.
Believe. Nobody can believe. The decision of other major countries to keep travel open was one of the great tragedies and missed opportunities from the early days.
Many countries cut off travel from China more completely than President Trump did, and sooner.
Travel bans work for the same reason that quarantines work. Pandemics depend on human-to-human transmission. Border control is fundamental to virus control. Since its establishment in 1948, the American people have generously supported the World Health Organization to provide better health outcomes for the world and, most importantly, to help prevent global health crises. With the outbreak of the COVID-19 pandemic, we have deep concerns whether America's generosity has been put to the best use possible. The reality is that the WHO failed to adequately obtain, vet, and share information in a timely and transparent fashion. The world...
Again, the World Health Organization declared a global emergency 6 weeks before Trump declared an emergency, and it produced 250,000 tests a month before the U.S. began any serious testing. It offered these tests to the U.S., and the U.S. said no.
The WHO failed in this basic duty and must be held accountable. It's time, after all of these decades. The WHO failed to investigate credible reports from sources in Wuhan that conflicted directly with the Chinese government's official accounts. There was credible information to suspect human-to-human transmission in December 2019, which should have spurred the WHO to investigate and investigate immediately. Through the middle of January, it parroted and publicly endorsed the idea that there was not human-to-human transmission happening despite reports and clear evidence to the contrary. The delays the WHO experienced in declaring a public health emergency cost valuable time, tremendous amounts of time.
Again, the WHO declared a public health emergency 6 weeks before President Trump did. President Trump also has been repeatedly falsely saying that the U.S. pays $500 million a year to the World Health Organization. The actual number is $57 million a year, so he's inflating it nearly 10 times.
On a daily basis points to the unreliability of the initial reports, and the world received all sorts of false information about transmission and mortality. The silence of the WHO on the disappearance of scientific researchers and doctors, and on new restrictions on
The president is suggesting that it's the World Health Organization who was spreading false information. As we walked through earlier, President Trump spent much of February talking about spreading false information about the coronavirus and its lethality himself.
Experts into China to objectively assess the situation on the ground and to call out China's lack of transparency. The outbreak could have been contained at its source with very little death, and certainly very little death by comparison. This would have saved thousands of lives and avoided worldwide economic damage. Instead, the WHO willingly took China's assurances to face value, and they took it just at face value, and defended the actions of the Chinese government, even praising China.
Now, I also want to highlight that the Trump administration did not renew funding that would have kept CDC offices in China and could have gotten more firsthand information for Trump earlier as well. Also, on January 9th was when the World Health Organization first reported the mysterious illness. The next day, the World Health Organization issued a comprehensive package of technical guidance and advice to all countries on how to detect and manage potential cases. And on January 23rd, they held a news conference. I don't want to preempt the president too much, but just suffice to say that the World Health Organization responded much more quickly, much sooner, with much more accurate information than the President of the United States.
Important public health recommendations and decisions. If we cannot trust that this is what we will receive from the WHO, our country will be forced to find other ways to work with other nations to achieve public health goals. We'll have no choice but to do that. Our countries are now experiencing, you look all over the world, tremendous death and economic devastation because those tasked with protecting us by being truthful and transparent failed to do so.
I have to say that President Trump is making an honest statement when he says that we are facing deaths and economic devastation because those tasked with protecting and informing us did not do so. I don't think he's referring to the right people when he makes that remark, though.
Work with others. All of the aid that we send will be discussed at very, very powerful letters and with very powerful and influential groups and smart groups, medically, politically, and every other way. And we'll be discussing it with other countries and global health partners, what we do with all of that money that goes to WHO. And maybe WHO will reform, and maybe they won't. But we'll be able to see, as you know, in other countries hit hard by the virus, hospitals have been tragically forced to ration medical care and the use of ventilators. But due to our early and aggressive action,
this is interesting because President Trump is now acknowledging that hospitals have been forced to ration equipment when at the same time, just yesterday, he was saying that there were, in fact, no shortages.
Talk you've heard where some states wanted 40,000 ventilators. I said, that doesn't work, 40,000. And they ended up with 7,000 or 8,000. And they had no problem. 40,000 ventilators for one state. It was ridiculous. The scariest day of my life was about a month ago when, after a long day of meetings, my team told me that we were going to be needing 130,000 ventilators, that we were short hundreds of thousands of ventilators. This is the system we inherited.
Okay, now it's amazing how many people President Trump is trying to scapegoat in this press conference. He's blamed the World Health Organization. He's complaining about the system he inherited from the Obama administration, and he's called the requests from New York for ventilators, quote, ridiculous. It's important to note that the Pentagon alerted him in the first year of his term that there was a shortage of ventilators. He had from 2017 until now to work to fill that, and he did not do so.
Of the crisis, those that didn't get ventilators were said to be in a position only of one alternative, and that was death. Would we be able to prevent Americans from dying because we couldn't get them ventilators? And the ventilators that they needed, and they needed immediately. I instructed my team to move heaven and earth to make sure that this didn't happen. We started to smartly ration and distribute the ventilators that we had and that others had. And I got daily updates on the supply we had from requests coming in and people wanting to have updates. We had a great group of people working on it. I instructed my team to use the Defense Production Act, and the Defense Production Act was used very powerfully, more powerfully than anybody would know. In fact, so powerfully that for the most part, we didn't have to officially take it out. It was a hammer. It was a very powerful hammer.
The president did not aggressively use the Defense Production Act. The Defense Production Act would have enabled him to direct all industries to begin making things the way FDR did during World War II. We could have had every manufacturer making ventilators. We could have had every apparel company making masks and gowns. Instead, to this day, we have a shortage of these things because the president resisted calls from governors to do exactly that.
Less productive ventilators or high quality. We've done a high quality ventilator. So we should have anywhere from 150 to 200,000 ventilators. In addition to that,
the president is praising the quality of the ventilators that he is going to be providing. The New York Times reported that thousands of the ventilators that he has distributed to states, in fact, arrived broken.
Or in Illinois or any other state that may need them if we have a surge. I'd like to ask Adam Bowler to come up and just say a few words. He's done a fantastic job, a young man who worked 24 hours a day on handling this situation, and I'd just like to have Adam, wherever he may be, come up and say a few words. Adam, please. Thank you very much.
Thank you. Thank you, Mr. President. At your direction, this country has worked hard over the past few weeks to ramp up ventilator production through all means possible. Thousands of ventilators are coming in now.
Okay, it just is not true to say that we have been ramping up production by all means possible. We walked through the timeline earlier. States of emergency had been declared in the U.S. From at least the beginning of March. It was not until March 18th that President Trump first began invoking the Defense Production Act. Not until March 27th did he call upon General Motors to produce ventilators to combat the coronavirus, and we have to date serious shortages of supplies as a result.
Top health systems from New York City, New Orleans, Washington State, and California. Over a week ago, these places would have needed help, but now they are here to help. There's been no American that has needed a ventilator that has not received one. This dynamic virtual reserve, combined with our strategic stockpile, will ensure that this is always the case. I'd like to thank the President for his leadership and directive to focus on public-private partnerships like this one. I'd also like to thank Sam Hazen from HCA, Lloyd Dean from Common Spirit, for leading this effort with the AHA and the Federation of American Hospitals. These have been difficult times. A few weeks ago, the Vice President came into my office and he reminded us of the power of the resilience of the American people and of private companies. We needed it that day, Mr. Vice President. This partnership is another example of Americans helping Americans. Thank you.
Thank you very much. Fantastic.
Thank you, sir.
I'd shake his hand, but I'm not allowed to. Times have changed, haven't they? Thank you very much. You did a fantastic job. We're very proud of you. You and your whole team. Thank you. Today we are taking further action to maximize our oversupply and available ventilators. This afternoon I met with the leaders, the top people of many of America's big, powerful, beautiful, and very, very important hospitals and hospital associations who join us today. We had a great meeting, learned a lot, and they've been going through a lot. They've been doing a fantastic job, as everybody here will attest. I'm pleased to announce that my administration is partnering with the hospitals across the country to create an innovative new system called the Dynamic Ventilator Reserve, so that we're going to have tremendous numbers of ventilators that we're able to help our states with at a later date. If there's ever a problem like this, which we hope to God will never happen again. It was 1917, 1918. That's a long time ago. We hope it never happens again. And I'd like to ask Rick Pollack, CEO of American Hospital Association, Sam Hazen, CEO of HCA Healthcare, that's the largest in the United States, Warner Thomas, CEO of...
I want to call out one very important false thing that has already been said. In Adam Bowler's statement, he said definitively that no one has died from the lack of a ventilator in this crisis. And not only is that a false statement, but it's a statement that he couldn't possibly have had the data to make because there simply is not full reporting of how many people may have. We can confirm that we know of at least one instance that one of our reporters has been able to directly confirm of a person who died in a hospital where there was a decision that needed to be made which of 3 patients would get the last remaining ventilator. And so this situation of people dying without access to ventilators, which the Trump administration here has said is not occurring, we can confirm at least one specific case, and it is likely, given the shortages, that there are many similar cases.
A few. I don't know if he caught Dr. Fritz Francois from NYU Langone and David Dill, the CEO of LifePoint as well. We appreciate the work of the administration in helping us find innovative solutions.
Also, regarding the man who made the false claim that no one has died for lack of a ventilator, that is Adam Bowler. He is the CEO of a finance corporation, not a health company. And he's an old friend of Jared Kushner, who became involved with the coronavirus response when Jared Kushner became involved in the coronavirus response. Jared Kushner is involved in the coronavirus response for reasons that are not clear. He has no experience with crisis management or with public health. His only known relevant claim to fame is that he is the son-in-law of the President of the United States.
To be a part of this private-public sector partnership, and I think it's going to do great good for the community. So thank you very much.
Great job. Thank you.
Thank you, Mr. President. It's great to have Ochsner Health be part of this program. We certainly have been a recipient, and the state of Louisiana has been a recipient of help getting ventilators to our state and to Ochsner Health. We're currently taking care of about 60% of the COVID patients in New Orleans, and we did see a spike over the past few weeks, but we're starting to get on the other side of that and heading in the right direction. I also want to thank you personally for helping Ochsner Health. A couple weeks ago, we were running short on surgical gowns, and you and your team were able to direct some to New Orleans, which was helpful to us and other hospitals around the New Orleans area. So we're excited to be part of this dynamic ventilator reserve, and we are proud to be part of that and help other communities around the country. Thank you.
Thank you, Mr. President, for the invitation here. On behalf of the Cleveland Clinic, I would just like to offer a slightly different story about the COVID pandemic. In our home state of Ohio, with an early institution of social distancing, our ability to scale up the testing and ramping out the capacity, we have actually seen a stable number of patients over the last 8 to 10 days. Only 160 patients have been hospitalized with COVID infection in Cleveland Clinic Health System. We are also very grateful for the support from our state government as well from our federal government. This is a battle where we're all in together. We coordinate our efforts, share our resources, and work together as one. I'm firmly convinced that we can do a lot of good when we work together. Thank you very much for having us. Thank you, sir.
Thank you all. Great job. That was a terrific meeting, and thank you all for being here. Thank you very much. The United States has far more ICU beds per capita than any other nation. We have 34.7 ICU beds per 100,000 people, which is the best there is, compared with roughly 12.5 beds per 100,000 in Italy, 11.6 beds in France, 9.7 beds in Spain. Think of that, 34.7 we have, and 6.6 in the UK. There are more than 60,000 ventilators at hospitals and other healthcare facilities that are not in use at this moment. They didn't need them. We got a lot of them out, and they didn't need them. And that's a good thing that they didn't need them. But a lot of good brain power was involved in making a lot of fantastic decisions. I want to thank our Vice President for the task force, and I want to thank all members of your task force on having done an incredible job. You really have done an incredible job. Thank you, Mike, very much. Through this new partnership with the hospitals, unused ventilators will voluntarily lend them where they have unused ventilators. They will voluntarily lend those ventilators to other hospitals and other areas of greater need. Within the last several days, more than 20 of our nation's largest health systems have already pledged more than 4,000 ventilators should we need them. And I've been told that if they need more, there are more there. We're going to be helping.
Now, the president keeps suggesting that hospitals and doctors are getting what they need. We know that in New York, they're very short supplied on all medical supplies like gowns, masks, and other face shields. Some hospitals are not relying on the federal government anymore and are instead doing do-it-yourself adjustments. Doctors in one of the largest hospital systems in New York were recently given guidance on how to ration ventilators, should it be necessary. In New Jersey, the state with the second most number of cases, Governor Phil Murphy has said that the state still suffers from inadequate testing and a lack of federal support. He said, quote, "No state has the resources they need to test at the scale they need to test." Governor Charlie Baker in Massachusetts, another state that is rapidly becoming a hotspot, has asked for 1,700 ventilators, but has received just 400.
Is taking place during this period of time, and that's innovation. I call it innovation under pressure. There's a big difference. Innovation under pressure, right? Cleveland Clinic knows all about that. As we prepare for the next phase of this great struggle, we must also do everything in our power to restore prosperity for the American worker. There's tremendous interest and excitement surrounding the administration's efforts to get the economy roaring once again, and I think it's going to roar once it gets open. I think it's going to go up tremendously. You see what's happening with the stock market already, because a lot of the very smart financial people, the great minds, they're looking at the stock and they're saying, wow, because what they're really seeing is how we're doing. If we weren't doing well, the market wouldn't be at a level that it is today.
Okay, the market has gone up in recent days. That is a very low bar given that it just capped the worst quarter in its 124 years.
The world, as we share their enthusiasm to get our country going. So I thank them for wanting to contribute, and we look forward to speaking with many industry leaders, seeking their input on how we can return to what was until very recently the greatest economy anywhere in the world.
This is not a true statement that he continually makes, that the economy was the greatest ever in the history of the world. By many metrics, the economy has been stronger, and most importantly, real wages when adjusted for inflation had been declining.
Employment numbers we've ever had, and the best employment numbers we've ever had. Everybody was doing well. Stock market at a record.
The stock market did hit record highs, but it was growing at a faster rate under President Obama, and it is not true that everyone was doing well. Many people were left out of the recovery.
Being finalized, and we will soon be sharing details and new guidelines with everybody. I will be speaking to all 50 governors very shortly, and I will then be authorizing each individual governor of each individual state to implement a reopening and a very powerful reopening plan of their state at a time and in a manner as most appropriate. The day will be very close because certain states, as you know, are in much different condition and in a much different place than other states. It's going to be very, very close, maybe even before the date of May 1st.
Okay, there is a lot that is alarming in this statement. The president is again suggesting that he's going to force governors to reopen upon his timeline instead of on theirs. He's saying that it may happen sooner than May 1st. The Institute for Health Metrics and Evaluation at the University of Washington warns that a reopening before May 1st would lead to, quote, a second wave of coronavirus. He also has said that there are many areas of the country that are differently impacted than others, and the fact is that until there is widespread testing, we cannot know the penetration of this disease in every area of this country.
Big producing countries can't believe what we were able to do. We will hold the governors accountable. But again, we're going to be working with them to make sure it works really well. Now, we have a list of people that I'll be speaking to over the next very short period of time, in many cases tomorrow. We're going to have elected officials, and we'll be submitting that list to you within the next 24 hours. But we have a list of different industries that I'll be discussing by meeting by telephone, because we don't want people traveling right now. The American Farm Bureau Federation, Zippy Duval, Cisco System.
By the way, the president referred to not wanting people to travel or meet in person. He had 13 health industry CEOs in the cabinet room earlier today.
Tractor Supply Company, Seaboard Corporation, Grimway Farms, Mount Air Farms, and others in the agricultural business. In banking, it's Bank of America. Brian Moynihan's been great. J.P. Morgan Chase, Jamie Dimon. Goldman Sachs, Citigroup, Wells Fargo, U.S. Bancorp, Morgan Stanley, James Gorman, Grand Rapids State Bank, Southern Bancorp, all great institutions with lots to say and lots of good ideas. And if you look at how Paycheck has been working out, the numbers are incredible, and I hope Congress is going to be able to supplement the amount of money going to our workers.
The president has been lauding the rollout of the Paycheck Production Program. It's important to note that the program has been a real mixed bag. While it has processed a large number of loans, many bank locations have been utterly overwhelmed and been unable to operate the process, and the website was crashing in the initial days because of the heavy demand.
Trades Union, Sean McGarvey, these are a lot of friends of mine. Laborers International Union of North America, Terry O'Sullivan. International Brotherhood of Teamsters, James Hoffa. National Electrical Contractors Association, David Long. Bechtel, Floor. National Association of Home Builders. Association of Builders and Contractors. Associated General Contractors. Richard Trumpka, AFL-CIO. G.H. Palmer. So these are some of the unions, pretty much almost all of the ones that will be on the line. In defense, we have Lockheed Martin, Honeywell, Northrop Grumman. These are all the top of each company, CEOs, chairmen, presidents. Raytheon, General Dynamics. Energy, we had a tremendous success recently with energy over the weekend. It finished with tremendous credit going to Russia and Saudi Arabia, and it could be as much as 20 million barrels a day, a cut, so that we can get rid of some of the tremendous excess oil that's been produced because of the fact that the virus just knocked out almost 50% of the business. It's been an amazing achievement. Some people say one of the biggest oil deals ever made, maybe the biggest oil deal ever made. They're saying, I didn't know that, but we were involved in getting that done, and it was very important. We're going to save hundreds of thousands of jobs for our...
Part of the deal, the U.S. agreed to compensate Mexico for producing less oil. So we've gone from Mexico will pay for the wall to the U.S. will pay for Mexico not to produce oil.
Some nations outside of OPEC. And I also want to thank the president of Mexico because he was terrific. He showed great dexterity and flexibility in getting the deal done. We want to thank him very much.
And as I said, that deal included the U.S. paying Mexico not to produce oil.
Sources: Chevron, Southern Company, Alabama Power, ConocoPhillips, Occidental Petroleum, Kinder Morgan, Hess Corporation, Perot Group, and a few others, big ones, great ones. Financial services, we have Blackstone, Stephen Schwarzman, Paulson and Company, John Paulson, Citadel, Ken Griffin, Elliott Management, Paul Singer.
So just if you're just joining us, the president is listing the names of companies that are going to be involved in what he has at times called the committee to reopen the country. He has suggested that he will be directing states, whether they like it or not, to reopen and roll back stay-at-home orders possibly sooner than May 1st. This is not in accord with the guidance of public health officials.
Cola, Pepsi-Cola, Chick-fil-A, Subway, Bloomin' Brands, Yum Brands, Papa John's, Wendy's, Waffle House, Starbucks, Wolfgang Pup, Thomas Keller, Jean-Georges, my friend Jean-Georges, and Danielle. You know them. From the transportation world, FedEx, Fred Smith, a legend, United Airlines, Oscar Munoz, UPS, David Abney, J.B. Hunt, YRC Worldwide, Crowley, Maritime, credible, big, powerful shippers and transportation companies. In telecommunications, we have the legendary John Malone of Liberty Media, Verizon, T-Mobile, Charter Communications, and Brian Roberts of Comcast. Thank you all very much. Healthcare, New York Presbyterian, Jerry Spire, friend of mine, HCA Healthcare, Sam Hazen, thank you, Sam. Just met with Sam. Ascension Health, Common Spirit Health, Community Health Systems, Trinity Health, Cardinal Health, McKesson, 3M. Thank you, Mike Roman, for helping us with face masks. It worked out well for everybody. Procter & Gamble.
The situation with face masks didn't work out quite so well. There is a severe shortage in hospitals across the country, as has been documented in the Health and Human Services Inspector General report.
Regeneron, Biogen, Roche, and Roche has been fantastic on testing. The job they've done, I have to call them out. They have stepped up like very few. Anthem, United Health Group, Aetna, Cigna, and Humana, all the big ones. The tech companies, we have the right ones. Apple, we have Tim Cook. Google, Sundar, thank you, Sundar.
A reminder that just about a month ago here in the Rose Garden, President Trump promised that Google was building a website that could help you find out if you had the coronavirus, and those plans did not come to pass, and it apparently came as news to Google when he announced it in the Rose Garden. One would hope that the companies whose names he's listing now have been consulted before he began reading their names.
Incredible companies that no other country will catch if they're smart. They have to be smart. But I've dealt with a lot of different countries, and I will say that the respect for Silicon Valley and our tech companies, there's nobody even close to our tech companies. They can't catch them, so they try and buy them. But we've sort of put an end to a lot of that. In sports, we want to get our sports back. So importantly, these will be some separate calls. Some will be together, by the way, lists, and some will be separate. But we have to get our sports back. I'm tired of watching baseball games that are 14 years old. But I haven't actually had too much time to watch. I would say maybe I watch one batter and then I get back to work.
It would seem to be true that the president does not have time to watch baseball games based on the amount of retweets he gives from Fox News. he seems to spend most of his TV viewing time, which is substantial, focused on things other than baseball.
Jay Moynihan, LPGA Michael Wan, USTA Patrick Galbraith, Major League Soccer Don Garber, WWE the great Vince McMahon, NASCAR Lisa Kennedy, thank you Lisa, NHL Gary Bettman, from the New England Patriots Bob Kraft, Dallas Cowboys Jerry Jones, Dallas Mavericks Mark Cuban. And some of the thought leaders that we're going to have, and there are some others that we are having, we're just waiting to hear, but everybody's saying yes, I must say. John Allison, Heritage Foundation, Kay Cole James, great person. Hoover Institute, Condoleezza Rice, another great person. Art Laffer, Steve Moore, Steve Forbes, Larry Lindsay, Catherine Reynolds, Scott Gottlieb, just spoke with Scott, Jim DeMint, and Jim has been a terrific friend, Bill Haggerty and Ray Washburn. And religious leaders will be coming on Friday. We'll be speaking to, and we're going to have a separate list, but we have tremendous enthusiasm to meet by our great religious leaders. We have incredible people, and they want to be a part. And we'll be talking about churches, and we'll be talking about opening, and we'll be talking about things that are very important to a lot of people, including me. We're going to find it.
I just want to highlight now, the president is talking about these plans that he's making to reopen everything. He's highlighting multiple industries, sporting events, churches. In every statement from the actual health professionals, Dr. Fauci has been saying now is not the time to take our foot off the gas. The guidance from Dr. Fauci and Dr. Birx has been that we need to further flatten the curve and that it is not the time to begin loosening these restrictions.
The governors will be held accountable. If they need things, we'll help them get those things, but we want them to do their testing. We want them because they're equipped to do testing. We've created incredible tests, and we've done more testing than anybody's ever done in the world right now. And we had a broken system, and now we have a great system. We have a system where other countries are coming to us and saying,
this is not true. This is misleading. The World Health Organization did provide tests very early. We said no to those tests. The first batch of tests that was produced here in the U.S. was faulty. While the U.S. has finally produced the greatest raw number of tests, we are 42nd in the world in testing per capita. And the fact of the matter is that there are not enough tests to go around. And as I quoted Governor Phil Murphy from saying earlier, no state has the resources they need to test at the scale that they need to test.
Into their states, and they run their states very strong. Eventually, we won't have to do that. Eventually, this will be gone. But for a while, we're going to do it. So they're going to take charge at their borders. They're going to take charge of people coming in, and maybe to an extent, depending on what they work out with a nearby state, it may be also people leaving. And they'll be able to do that very shortly. We'll be announcing a date, but it'll be very short. And frankly, it'll be at a time that will be earlier than the deadline that we imposed, the end of April. So we think that some of the governors will be in really good shape to open up even sooner than that. We'll speak to them, but we're all set. We're counting on the governor.
Again, one of the nation's leading medical modelers said this week that attempting widespread reopening of the country by May 1st would lead to, quote, a second wave of the coronavirus.
Situation. But in almost all cases, it's all starting to come down. We're very proud of the job everybody's done. And
it is not true that the number of cases is starting to come down. The number of cases continues to rise here in New York, where we are beginning to flatten the curve. The number of hospitalizations is slowing. The growth is slowing, but there are still more hospitalizations every day, and the death toll remains staggering, with over 800 people lost on a single day on multiple days in the past week.
Cut it in half. That would be 1.1 million people. That's many more. That's double the Civil War. And if you cut that in half, you're talking 500,000 or 600,000 people. That's what we lost in the Civil War. And that's cutting it, cutting it, cutting it. And we're not going to, that would not be acceptable. It would not be acceptable. One life isn't acceptable, but we weren't given that option.
I want to point out again, while it is true that there's not an option where there wouldn't have been one death, again, compare the response of South Korea, which had its first case on the same day as the United States. They have only had 222 deaths, whereas the U.S. has had close to 26,000 deaths. And while the number of deaths you would expect to be more based on the larger population, the U.S. should have a death rate roughly 6 times South Korea's, not 113 times. Also, I want to circle back to President Trump talked about how wrestling mogul Vince McMahon will be part of his committee. The WWE was declared an essential business by Florida so that these sweaty wrestlers could fail to social distance by piling on top of each other. And unlike luchadors, they don't actually even wear masks. I also want to point out that Vince McMahon's wife, the former head of Trump's Small Business Administration, also runs a super PAC that has reportedly prepared to spend $18 million on Republican candidates in Florida. So one might ask if that could have factored into the decision to keep wrestling open in Florida despite the current crisis.
A very beautiful process. Our discussions will focus with the people that we're dealing with on rejuvenating the economy and always health, always health. Health and life living is number one, but the rejuvenated economy, and I think it's going to go quickly. We'll be utilizing our robust testing capacity for the governors. We'll be giving them what they need if they don't have it themselves. We hope by now they'll be able to have it themselves. We were hoping they would have had it themselves early on, but they weren't. But such great advances have been made. So we'll be dealing with them on that. And they can rely on us very strongly. They're going to be relying on us, I think, for some help. And we're there, whether it's building hospital beds, which I don't think they're going to need. You look at Javits Center, a great, great job that the Army Corps of Engineers did. FEMA got involved. We actually ended up sending our medical people. That was not a COVID-19 center, and they asked, could you do that? And then even after we did that, it was not used very much, meaning they didn't have to use it nearly to the extent that they thought when they conceived it. It wasn't that they made a mistake. Nobody made a mistake. We built it. I'd rather have too much than too little. Err on the side of caution. And it's really incredible what they did, including the two great ships. And I just want to thank a lot of really great people, a lot of great politicians. And again, we're going to be announcing the political list tomorrow. And on there, we're going to have a lot of senators. And we're going to be having a meeting with the governors probably on Thursday, a meeting by teleconference. And a lot of things will be discussed, and some of the details will be discussed. But we want them to do an incredible job of running their states. I think they'll do an incredible job, too. After having gotten to know so many of them, I think each one of them will do an incredible job. And again, the federal government is there. We have ventilators if they need them. We have beds if they need them. We have hospitals if they need them. We have a testing capacity that's now second to none, where, again, other countries are calling us.
Again, we are substantially behind the rest of the world when it comes to testing. And in terms of ventilators, I just want to highlight that New York is saying that they still need 14,000 more than we have. New Jersey says that it will need 5,000 more than it has. Michigan fears that it could need 27,000 more than it has. And President Trump, who just now said we'd rather have too much than too little, has seemed to repeatedly mock governors for asking for too much.
We've had problems with them for years. It doesn't matter. We're looking at a term of 60 to 90 days. We're doing a very thorough investigation right now as we speak. But this should have been done by previous administrations a long time ago. And when you look at the mistakes that were made, all of the mistakes that were made, it's just something we have to look at. And it is very China-centric. I told that to President Xi. I said the World Health Organization is very China-centric, meaning whatever it is, China was always right. You can't do that. Can't do that.
So the president is back to slamming the World Health Organization. Again, the World Health Organization declared a global health emergency 6 weeks before he did and produced 250,000 tests a month before the U.S. began any serious testing. He's criticized the World Health Organization for being too pro-China, but his initial responses to China on the pandemic were to praise China. He said that China handled it, quote, really well and did a, quote, very good job.
The way of doing it, but we have not been treated properly.
Mr. President,
Yeah,
Mr.
please.
President, you mentioned that you're going to be speaking with all the governors
Yes.
tomorrow, make recommendations.
On probably Thursday.
On Thursday. What if they don't listen to you or take your advice or obey you? Will you consider taking away their federal funding?
I don't want to say that. They'll listen. They'll be fine. I think we're going to have a good relationship. They need the federal government, not only for funding, and I'm not saying take it away, but they need it for advice. They'll need maybe equipment that we have. We have a tremendous stockpile that we're in the process of completing. We're in a very good position. Again, the cupboard was bare when I got here. Nobody ever thought a thing, in all fairness to previous administrations, nobody ever thought anything like this was going to happen.
That is fundamentally not true. We released a video this week of President Trump warning in 2014 that a global pandemic could come, and his administration did things to prepare for it, such as creating the Global Health Security Unit within the National Security Council and creating a 69-page document to leave for future administrations that was called the Pandemic Response Playbook.
Managerial standpoint is to let individual governors run individual states and come to us if they have difficulty, and we will help them. Yeah, John?
You talked about having testing and tracing equipment and the facility for that in place to open up the government. Dr. Fauci said this morning that critical testing and tracing ability does not currently exist.
Well, I don't know. Look, I don't know.
Will
John,
it,
I don't know what he said.
my question is,
Nobody knows.
My question is, will it exist by May 1st?
The individual governors have testing. The individual governors, we have many forms of testing, and new testing is being developed. Our country has to get open, and it will get open, and it'll get open safely and hopefully quickly. Some areas quicker than other areas, but there is tremendous testing, and the governors will use whatever testing is necessary.
Again, there is not a nationwide system of testing, and as Governor Phil Murphy said, I'm going to read this quote again, quote, no state has the resources they need to test at the scale that they need to test. And this lack of testing is one of the main things that is standing in the way of states reopening.
But I know there have been problems, and it's been very unfair to the United States, just like the World Trade Organization has been very, very unfair, and now they're coming into line. When they consider China a developing nation, and because China's a developing nation, they take massive advantage of the United States. Why didn't other presidents stop this? I've been talking about it from the day I got in, and we're looking at that very, very strongly. World Trade, So I have a problem with World Health and World Trade, both of them. I'm not sure which is worse, you want to know the truth, but we'll figure it out, okay?
Mr. President.
Go ahead,
Mr. President. Mr. President, you were just criticizing the WHO for praising China as transparent, but you were saying many of the same things about China just a couple of months ago. So, I mean, how do you square your decision to...
Well, I did a trade deal with China, where China's supposed to be spending $250 billion in our country. We're going to be watching very much to see. Now, we got a little bit waylaid by the virus. But look, I'd love to have a good relationship with China. But if you look, and we made a phenomenal deal. China has paid, because of me, China has paid us tens of billions of dollars over the course of a very short period of time. Billions of it. Some of that money has been spent to farmers where they were.
Okay, this is not true. This is a false statement that President Trump says repeatedly. He repeatedly claims that China is paying billions of dollars in the tariffs that he's placed on goods. I honestly do not know whether he is intentionally lying or whether he does not understand what tariffs are. I learned in Economics 101 what tariffs are. Most people with even a basic introduction know that tariffs are essentially taxes paid by importers. U.S. companies importing Chinese goods are paying these tariffs, not the Chinese government.
It's up to the governors. Go ahead, please.
Mr. President,
Go ahead, please.
just get back.
Quiet. Quiet. Quiet.
Mr. President,
they are
how many?
following your lead that they are not social
The
distancing.
governors are doing the testing. It's now not up, and it hasn't been up to the federal government. Go ahead.
Mr. President, I'm going to have a quick follow on the WHO, but if May
I
1
told them when they put this guy here, it's nothing but trouble. He's a showboat. If you keep talking, I'll leave, and you can have it out with the rest of these people. If you keep talking, I'm going to leave, and you can have it out with them. Just a loudmouth. Go ahead.
If you could kind of clarify, are you basically lifting your slow the spread before the May 1 deadline?
No,
And then,
I'm
and
not
then
at
how,
all.
and
No.
then how many
The
states?
governors are going to be running their individual states. Some of them will say, no, I can't open now. And some of them may last longer than we even would think. Others will say, I can. You can go. I don't want to mention states, but there are numerous states that are in great shape right now. They're viewing the rest of the country like, we don't even believe this is happening. We have a lot of those states. They're set to open practically now. I mean, they would be open now. We're going to let them open sooner than the date. We're going to pick a date. We're going to get a date that's good, but it's going to be very, very soon, sooner than the end of the month. But there are many states out there that are looking at this, and they're reviewing it, and they're saying, we shouldn't be even included in this. You know, there are some that want to open up almost now. Now,
I need to highlight, there are a lot of states that believe they have a low number of cases and in fact do not, because they do not have adequate testing.
so we're there to watch. We're there to help. But we're also there to be critics. And on testing, very important, we've always wanted the states to do the testing. We're now providing great testing, but the state has to provide the great testing. The state has to provide the ventilators, but they didn't do that. So we ended up going into the ventilator business, essentially, and we've made tens of thousands of ventilators, and we solved a big problem for the states. But we want them to do the testing, and we are there to help. Yeah, please.
The president keeps trying to pass the buck on who is responsible. He says that he has the sole authority to determine when states will open and close, but it is the state's responsibility to figure out when and how to do the testing or get ventilators for themselves. This is a talking point that has been debunked. States are not capable of responding to a national emergency. As Obama's Health and Human Services Secretary Kathleen Sebelius said, states do not have the purchasing power of the federal government. They do not have the ability to run a deficit like the federal government. They do not have the logistical power of the federal government. There is no way that states could have provided these ventilators for themselves.
Dollars in tariffs. So we're taking in, wait a minute, we're taking in billions of dollars for China. From China, they never paid us 10 cents. That's a great thing.
Again, we are not making money from China in tariffs. The tariffs are being paid by U.S. importers, not by China.
Look, we have an investigation underway. We're paying almost $500 million. We have an investigation underway on the World Health Organization. We will find out exactly what went on.
President Trump just again falsely claimed that the U.S. pays the World Health Organization $500 million a year. This is simply not true. It is about $57 million per year.
WHO for praising China for being transparent, but you also praise China for being transparent.
I don't talk about China's transparency.
January, there
Well,
was
you know, if I'm so good to China, how come I was the only person, the only leader of a country that closed our borders tightly against China?
That is simply not true. Many countries closed borders to China. Many did it sooner and more completely than President Trump did. The first one that comes to mind is Vietnam.
Rick can tell you that better than anybody. I was the one person that wanted to do it. You know why? Because I don't believe everything I hear. And I closed. And if we didn't close our border early, very early, long before the kind of dates you're talking about, we would have had thousands and probably hundreds of thousands more deaths. Please.
Okay, this is simply not true what the president is saying. This is a false statement that he often makes. Ian, if you're able to put Megan's fact-check video on Trump's China claims in the comments, that would be good. He's falsely claiming that he did it early. He did it later than other countries. He's falsely claiming that everyone was against it. He actually did it in conjunction with his public health officials. He's falsely claiming that Democrats criticized him for it. Democratic leadership did not, in fact, criticize him for it.
Countries haven't, some countries haven't. I'm watching other countries. I'm studying other countries as they open. I mean, I don't want to go into names because for some it would be a little bit embarrassing. But I'm studying other countries as we go along. So on that, we have looked at every country that's opened, some successfully, some okay. No total disaster, but some okay. And some have to go back to the hot spot and fix the hot spot. We think we're going to do it very successfully. Again, we have one country, but we have lots of different pieces. It's a puzzle. We have beautiful pieces, beautiful states with capable governors. They know when it's time to open, and we don't want to put pressure on anybody. I'm not going to put any pressure on any governor to open.
This is really confusing. He's saying that the governors know best when to open, and he's not going to put any pressure on any governor when to open. Earlier in this very press conference, he said that he was going to tell the governors when they should open, and even suggested that he might withhold medical supplies to pressure them.
As it comes along. Please go ahead, behind you.
Yes, just a quick question. You spoke about Governor Cuomo. Just wondering if you have any thoughts on some of his remarks from earlier today, where he basically said that were New York to be pressured to be open, it would cause a constitutional crisis. And he basically said that you declared yourself King Trump. So I'm wondering if you heard those thoughts.
I've declared myself as king. You know, I heard he said that, but I didn't see the remarks. But he understands how we helped him. He needed help. We gave him 2,900 hospital beds. He didn't use them. We gave him a ship. He didn't use them. And I'm not saying, but I'm saying that's good, because you know what? That means he didn't need them. But we said it was too much, but we wanted to err. We said, err on the side of caution, as I said. We said, look, we don't think you need it, but if you do, we're going to have them built. And the Army Corps of Engineers did a fantastic job, and the U.S. Navy did a fantastic job, and we moved a ship that was not meant for COVID, and we had it redesigned for COVID, but they still didn't have very many people going in. Now, we'll get along just fine. He understands. We'll get along just fine, please.
The president is painting a rosy scenario in New York. I want to highlight that here in New York City, we are digging on public land to create mass temporary graves for the number of people who are overwhelming funeral homes and morgues.
Now, I think that companies can do testing on a maybe weekly basis. You don't have to do it every day with the same worker, but they can do testing. They could do temperature gauges. They could do a lot of different things. And, you know, we're only talking about for a period of time. You know, eventually we want to get back to where we were. We want people actually sitting next to each other in ball games eventually. You know, we're not going to rip out every other seat in baseball stadiums and football stadiums. We want to go back to where we were. I want people to understand that. We're not going to be like the way you are. We have 300 reporters in the back that want to sit. Look at this, the way this looks. I don't even like the way it looks, although I have a lot fewer reporters. That's okay with me. But look at the way this looks. I've never seen anything, John. I've never seen anything quite like it. But there are a lot of people. We don't want this. I don't want this. I don't want this. Eventually, we're going back where restaurants that had 150 seats are going to have 150 seats, not 50 seats, because they can't make it at 50 seats. But more importantly, the atmosphere is even better. We have to get used to it. We have to get used to it. I don't know that people are going to be shaking hands as readily. Some will. I said to some of the hospital people today, so will people be shaking hands again? And I must say, I was a little surprised. Most of them said probably. because there is some kind of a thing to it. I was never a big handshaker, but when I ran for politics, I said, I think I better start shaking people's hand. Go ahead, John.
Mr. President, a couple of financial questions, if I could. Larry Kudlow said this morning that at the current run rate, the Paycheck Protection money will run out very soon. The plan to re-up it is stalled in Congress. What can you do as president to try to move that forward?
Well, we're trying to get it done. The problem is the Democrats want to put all sorts of things. Last time they put Kennedy Center in, I hated.
What the Democrats want to add to the bill is, so the president is seeking more funding for small business loans. The Democrats support this, but they say that it must be paired with more money for hospitals and local governments. The reasons should be pretty obvious. The hospitals are overwhelmed with patients, but Republicans are saying that hospitals and local governments will need to wait.
But it's been a tremendously successful program. I think you see it. The banks have stepped up, hundreds of thousands of loan applications approved. Money is going out. It's been a tremendous program. Really, it's been. And obviously, it was at a point where we're almost, the money will be expired, and we could use a refill for the workers. We want to be able to make sure that small businesses stay open, John, and I think that'll happen. Yeah, go ahead.
Mr. President, today California's governor set out a list of 6 criteria for reopening the economy there. Did he consult with you on that? And also, you said earlier that there were as many as 20 states that could reopen their economies as early as May 1st. Could you list some of them?
No, I didn't say all of them by May 1st, but there are 20 states. Actually, I was given a number. 29 states are in very, very good shape. I don't want to say whether or not the governor spoke with me about that, but we've had a very good relationship. Gavin Newsom.
We will not know what states are in good shape and what are not until there is widespread testing.
One question.
But the person who can't be here, and so I...
Who cares? So if you can't be here, that's too bad, right?
All right. Well, one question that I have is about from the United Nations, an economist, Maximo Torero, says that there's a danger that the food supply could be interrupted during this pandemic, and I wanted to know what you're going to do about that.
Well, I think our farmers are incredible. They're producing levels of food like just unbelievable. Our transportation, that's one of the reasons I have the transportation people on the line tomorrow for the delivery of the food. No, we're doing phenomenally with the food, and I will say the stores, Kroger and Walmart, which does a lot of the food, and many of the stores, they seem to be in very good shape, but I haven't heard that at all. We're going to be very strong on food supply. Okay, how about one more question? Go
Mr.
ahead,
President,
please.
yes, the death projections that you mentioned earlier are based on full social distancing until the end of May. So if you ease up on these guidelines now, how many more Americans do you think are going to die?
Well, I'm not easing up. First of all, we'll have guidelines, even for the states that open, and there'll be guidelines. But we will not have any problem with that. Your question's a very interesting question. But the states that are opening are not states which will have a problem with that. Plus, they will have to adhere to guidelines.
The president is making a very bold promise that there will not be any problem with states experiencing more deaths as they begin to reopen.
And some of that will stay in effect. Much of it will stay in effect for a period of time. But the reason also is they're different kinds of states. They have lots of room. They have fewer people, and they have lots of room. And that's one of the primary reasons. I want to thank you all very much. So a lot of positive things are happening. We're going to have some very strong recommendations for the governors. We're going to work with the governors. The governors are going to do a good job. And if they don't do a good job, we're going to come down on them very hard. We'll have no other choice. Thank you all very much. Thank you. Thank you.
On testing, how are we going to get to a point where we have millions and millions of tests with workers to be tested every day when they go to work?
Okay, so that was the president. Now, I'm interested to see if any of the actual health experts are going to speak. It appears not. It appears that Dr. Birx was brought out there today to say nothing. Dr. Birx, who is an actual medical expert, she was not allowed to speak. The president laid out a plan to reopen the country perhaps earlier than May 1st, and he did not give an opportunity for Dr. Birx to speak to that at all. And I wonder, I do rather wonder if this was a good use of her time to be here today when she was not even invited to take questions or brief the press. So this has been another, I don't know how many times I can say that this has been a startling, shocking, and disturbing presidential briefing. To review what happened, perhaps the most remarkable moment was that the president announced that he is going to cut off U.S. funding for the World Health Organization in the midst of the worst global health pandemic in a century. I'm going to say that again. The President of the United States announced that he is going to cut off funding for the World Health Organization in the midst of the worst global health pandemic in a century. He based that on his objection that he doesn't feel that the World Health Organization did a good enough job of responding. I'm going to say it again, that the World Health Organization declared a global health emergency 6 weeks before President Trump declared an emergency. It produced 250,000 tests before the U.S. began any serious testing. President Trump, at least twice in this briefing, falsely claimed that we pay the World Health Organization $500 million a year. That is not true. It is actually $57 million. President Trump also said that his objections to the World Health Organization are that it was too favorable to China. I just want to read a tweet from President Trump from January 24th. He tweeted on January 24th, just to set that in the timeline. That was after the CDC had issued its first warnings. That was after the World Health Organization had issued a comprehensive package of technical guidance. That was after the U.S. had had its first case of the coronavirus. That was after the situation in Wuhan was so severe that China shut it down. That was when Donald Trump tweeted, "China has been working very hard to contain the coronavirus. The United States greatly appreciates their efforts and transparency. It will all work out well. In particular, on behalf of the American people, I want to thank President Xi." So that was what President Trump was tweeting on January 24th, and he's now saying that we're going to cut off funding to the World Health Organization in part because they were too pro-China. President Trump also today said that he is going to declare when states will reopen. He said the reverse also. He said that states will decide for themselves, but he said that he will declare, and that if they don't do what he deems to be the right choice, that he suggested that he might withhold medical aid from them. He also mocked the demands of the governor of New York. He called New York's demands for ventilators and medical supplies, quote, ridiculous. He suggested that New York is not using the hospitals set up on the Javits Center or on the USNS Comfort. 2 people died of coronavirus in both locations today. New York State has over 200,000 cases of the coronavirus. New York has suffered over 10,000 deaths. That's families who are grieving loved ones, and the President of the United States is calling the efforts that the governor is making to try to avoid deaths ridiculous. That was the word that he used. And then, when reporters challenged him on these things, he threatened to walk out of the briefing. He snarled at them, told them to be quiet, and again, he did not allow his actual medical experts to speak at this briefing. So that's the news today from President Trump. I'm Alan Piper, the senior politics producer at NowThis. I was supported today by many in our newsroom, particularly Maddie Green, Zara Heder, Kavish Harjai, Matt McDonough, Ian McKenna, and Shelby Baculin. We are each working from our homes to give you the best news that we can. Most of us are here in New York, the global capital of the coronavirus. In spite of the President's efforts today to diminish the threat of this disease and his statements in the past to do so, I urge every one of you to stay safe, stay inside, avoid contact with others, wear a mask if you need to go out, wash your hands frequently, and very importantly, let the people that you love know that you love them. We are going to get through this together. I will see you tomorrow if there is a briefing. Have a good night, and please stay safe.